To your health news this morning, a really exciting new in-home treatment for Alzheimer's patients, making some pretty big waves in this area after trials of results just released show that this thing reverses memory loss. So bioengineers are behind this one. Take a look at that cap. It's a head cap with 8 emitters that emit electromagnetic waves directly into the brain. And what they're trying to do is disturb the pathology for Alzheimer's. So they're trying to throw that plaque or the buildup in there off course here. The company behind the device says 8 patients are part of the trial. They wore it an hour a day for 2 months, and they did see improvements that have never been seen before. The patients, who were all over the age of 63, actually returned to memory levels of a year ago. Makers of this technology believe it will work on people at any stage of this disease.
So far, there has not been a drug that has been shown to stabilize this disease, much less reverse it. And over the short period of time that we administered treatment, we got a reversal of the cognitive impairment of this disease. I'm not aware of any drug that has been able to do that.
So what's really interesting is this treatment can be administered by caregivers at home because it's not a medication, it's just a cap. So those who participated in the study, they all got MRIs, and those showed evidence of increased communication between the neurons in the brain, and that improved cognitive abilities. So this is a pretty exciting stuff. The company plans to do a bigger clinical trial of 150 patients. Again, right now they're just doing 8, and those patients will have mild or moderate Alzheimer's disease. That is set to happen later this year. So if they have similar results in that study, makers of this head cap plan to ask the FDA to make it an approved treatment for Alzheimer's disease. So really interesting that it's not a pharmaceutical, it's a cap. And I actually talked on the phone to a husband of a patient using it. He said it's incredible what it's doing for her.
Wow. So obviously it's very early in the trials.
Very early.
If it were to move forward with the FDA, I know you said it's treatment, would it be preventative as well? Have they talked about that?
They haven't talked about that. Right now they're using it for mild to moderate of the disease, but I think if you're at a higher risk of this, I don't see why it wouldn't be. You'd be able to use it. Basically, there's different proteins that build up in the brain, and then when they get together, that's what they believe is causing the Alzheimer's. So they're trying to break up that connection and not allow Alzheimer's to do what it wants to do.
Could you imagine if this moves forward
No.
and is one day?
Gosh, because
we
all know somebody
approved?
or family or friends.
Yeah, I mean, my mom has had it
exactly.
for a decade. So it's like, it's just exciting to see that they're kind of thinking outside the box a little bit, and they're not just saying, take a pill or do this. It's like, well, let's try other ways of attacking this. And again, the husband I spoke to, he goes, she is only allowed to wear it an hour a day. She wants to wear it more. She can remember where they went to dinner. She can remember things she couldn't remember a year ago.
That's really promising.
So it's very exciting to see what happens, because this has been a big unknown for a long time. Today is World Alzheimer's Day. Right now, 50 million people currently live with some form of dementia, and nearly 10 million new cases, think about that, 10 million new cases are diagnosed every year. So what are the symptoms to look for, and how are some things that you can do if you or someone you know is diagnosed? So joining us this morning to talk about this is Chris Martz, who is a cognitive support expert. So let's start with, first of all, thanks for being here. Absolutely. This is a very personal topic to me, and I want to start by identifying those symptoms, because they can be common, but we're looking for a pattern. So what are we looking for?
So you have a whole range of symptoms that start with what's considered normal brain aging, which would be maybe forgetting where you put your keys. You enter a room, oh, what did I come in here for? Those types of things.
And what age should we start to see those normally, and when should we maybe see that that's a little bit unusual?
Probably start maybe your early to late 40s. Would be those, because I know that's my typical, that's where I am, and I notice that it happens to me occasionally. Where you probably would want to maybe consider seeking medical advice is when you have a conversation and you start to lose words, and not be able to finish a thought, maybe not recognizing a familiar face. Maybe
that would be a big concern, I would think, because some of the other things you're talking about, forgetting where you put your keys or having those moments where you're just spacing something out, we all do that, right? So it's a pattern of consistency where you're going, gosh, I'm forgetting a lot, or my spouse or my sibling, or paying attention to other people's behaviors, that pattern that we're looking for.
Right, and a lot of it has to do with a real good sign of concern would be when somebody else is really starting to notice those, where you, at the beginning, you might, oh, maybe I'm starting to have some memory issues. But when somebody else is like, when I called, or, you really couldn't hold a conversation.
Respond, or we weren't being able to. So let's talk about reducing the stigma, because that's part of the awareness campaign. Is let's talk about this, because it is happening. It's happening, as we just said, in huge numbers, 10 million cases a year. So why are we still afraid to talk about this disease, or why are we afraid to go to the doctor and get diagnosed or get some information on what could be going on?
Alzheimer's is it's a frightening diagnosis to receive, and because most of us know somebody, or have had a relative, or know somebody that's gone through this, and just see the decline and how they can lose their personality. They stop recognizing their own children, and it's not only difficult on the person that's suffering, but for the family who's having to be the caregiver.
And that's a good something good to talk about for people who maybe are not experiencing this within their immediate family or within their immediate circle. If you know somebody who is, maybe offer them some help, even if it's just a chance for them to get out of the house and get a cup of coffee, because the burden on the caregivers is huge. And that's where you guys come in, and you can offer some respite care and just help those families deal with this without being consumed by it.
That's right. Yeah, a lot of times we'll get that call, and it depends. Some are very proactive. As soon as they get that diagnosis, they want to get somebody in there. They want to get a familiar face for a caregiver as things progress. Unfortunately, some people wait till the last minute where they're at wit's end. They're pulling their hair out, and they're like, I can't take it anymore.
Yeah.
And those are the times where it can really be difficult, especially trying to get somebody in there, and because they want to see familiar faces.
Right.
And as those connections in the brain start to fail,
they don't recognize it.
Exactly.
Yeah, it's not an easy process for sure, but you guys are able to offer some help. And again, World Alzheimer's Day is this Saturday. If you know somebody who you think might be struggling with this, start that conversation and try to offer them some help.